Hi, my name is Jackie and I'm from the Cardiac Rehabilitation Department. I'm here to talk with you about what you should and should not do after you are discharged from the hospital. You should first make sure that you have some important physician appointments lined up. You want to follow up with your surgeon about 1 week after you leave the hospital. This appointment may have already been made for you on your discharge instructions, but if it is not, be sure to call your surgeon right after you get home from the hospital to set this appointment up. You should have a visit with your cardiologist about 2 weeks after surgery. If you don't already have a cardiologist, a referral can be made for you by your surgeon. You should also follow up to see your primary care physician about 4 weeks after surgery. You should weigh yourself each day after you go home from the hospital, just as we've been doing with you here. When you wake up in the morning, use the bathroom and then weigh yourself. You should be tracking this weight each day so that way you know how much you're gaining. If you've gained more than 2 pounds overnight, that's something that you should call your surgeon about. You should also make sure that you call your surgeon if you have a fever of 101 or higher. So take your temperature every day. We want to make sure that you don't have any signs of infection. You want to make sure that you're taking good care of your incision to avoid infection. Each day, look at your incision in the mirror and see if you have any signs of infection. Those would be if it gets real red and swollen, if it gets hot and tender to the touch. If you have any pus-like draining, this is not normal and this is something that you should call your surgeon's office about. In addition to looking for signs of infection, you should also contact your surgeon if your sternum feels unstable or feels as if it's shifting or clicking inside of you. Each day, make sure you take a shower. As you shower, make sure the water isn't directly hitting your incision site. It's good to shower with the head facing the back of your body and let the water run over the top of the shoulders across the front of the body. Make sure you use a mild soap, something that isn't too strongly scented, as this may irritate your incision site. Use a clean washcloth each time you shower, or just the regular bar soap. Try to avoid using sponges or loofahs, as these may trap bacteria and bring a problem to your incision site that you would not have already had. As you shower, you should also make sure that when you lift your hands up overhead to wash your hair, that both hands come up together as opposed to just one, because this pulls on one side of the sternum. Any movement overhead should always include both hands. You should make sure that after you take a shower, sit and elevate your legs at about hip level for about a half an hour to encourage good blood flow back to the top of your body. Make sure you don't put any oils or lotions or spray perfume or cologne directly on the incision site, as this can act as an irritant to the healing of your incision. Women, you may feel more comfortable wearing a bra throughout the day, but if the bra is more bothersome to the healing of your incision, you can go without wearing that. Each day, you should wear your TED stockings. The TED stockings are those white compression socks that we put on your legs each day. You can't put these on yourself because that requires too much pulling. So have someone assist you and put these TED stockings on each morning after you wake up and take them off before going to bed. They should not be worn overnight while you are sleeping. You should wear these for 4 weeks after your surgery. In order to avoid swelling in your ankles, as you sit around your home, elevate your legs up at hip level on an ottoman or in a reclining chair, and try to keep your legs uncrossed because that can block the circulation. If your car ride home is longer than 1 hour, it's best to get out once during that hour and walk around to encourage circulation in your lower legs. As you sit around, whether it be at home or in a long car trip, you can do ankle pumps by pointing and flexing your feet to encourage movement of the circulation in your lower legs. You should also bring home with you your incentive spirometer. Continue to deep breathe 10 deep breaths every hour for the next 2 to 3 weeks during your recovery period. Your restrictions of no lifting, no pushing, no pulling, anything over 8 to 10 pounds lasts for the next 6 to 8 weeks. However, you may feel like you're not going to make a full recovery till a minimum of 10 to 12 weeks, as it can take a while for the body to regain its strength and endurance. Be sure to wear your heart hugger during the 6 to 8 week recovery period. You want to grasp the handles of the heart hugger during any position changes to support your sternum, as well as any sudden movement in your chest, such as coughing, sneezing, or laughing. As you recover, you will not be able to drive for the first 4 to 6 weeks after you are discharged from the hospital. Your cardiologist or your surgeon will tell you when you are cleared to return to driving again. Being a passenger is just fine, but you may find that the seatbelt coming across your chest irritates your incision site. To reduce the friction, you can bring a pillow or some sort of cloth in the car with you to cushion this area so that the seatbelt doesn't irritate your healing incision. It is important to stay active during your recovery period. Be sure to get up and walk around your home at least 5 times a day. If you feel like you don't have enough space to walk around inside, or you'd like to walk around more outside, it is okay to go outside and walk around, as long as the temperature isn't too hot and humid or too cold, generally below 40 degrees. Always dress for the weather if you're going to be going for walks outside. The distance that you should go walking outside is only as far as you feel comfortable going, knowing that you have to come back to the home. If you're going to go for a long walk on your own, you should probably take a cell phone with you, so that way you can call for help should you need it. You should walk with somebody initially, so that way you feel more comfortable should you unexpectedly have any symptoms. You can contact a mall close to your home to see if they have any mall walking programs. The benefit of walking at a mall is that you'll have a nice temperature-controlled environment with benches along the way to sit down and rest should you need to. Should you need to climb stairs inside your home, this is safe to do as often as you feel up to doing it throughout the day. Make sure as you hold onto the handrail, you don't pull yourself up or push your body off. Just hold onto the handrail for balance. You should always take each stair one at a time. When you bring one foot up, the other foot should come right next to it before proceeding to the next step. If you have incision sites on your legs, be sure to lead up with your non-incision leg as you go up the stairs. When you come down the stairs, lead with your incision leg. You're not restricted to the number of times that you can go up and down the stairs throughout the day. Just make sure that you feel up for it before climbing the stairs. If you feel short of breath or lightheaded as you're climbing, just stand or sit if you can do so safely. Take some nice deep breaths and then continue. You can refer to your cardiac rehabilitation guidebook for more information on home activities. There is a table inside that lists when you can expect to resume usual activities, such as gardening, ironing, doing laundry, but I encourage you to use this guide as only a guide and not a rule. Listen to your body. If your body doesn't feel up to doing certain activity, then you should not do it. As a general rule, any activity that you do that takes an hour or longer to recover from was probably doing too much. Next time, be sure to ask for help or do a little bit less. In addition to walking and home activity, you should complete range of motion exercises each day. These exercises can be found inside your cardiac rehabilitation guidebook. Each exercise should be completed 3 times a day, doing 10 of each. The exercises are designed to help move around the upper body and put more motion into your joints as you continue to heal and recover from your open heart surgery. When you follow up with your cardiologist, you can talk with your doctor about participating in an outpatient cardiac rehabilitation program. These cardiac rehabilitation programs will help you begin an exercise program or get back into exercise knowing that you're doing it safely. Your heart rhythm, your blood pressure, and your heart rate will all be monitored while you're at this facility, and everything will be reported back to your cardiologist. The American Heart Association recommends that everyone strive to do between 30 to 60 minutes a day of activity to improve the health of their heart, and a program like Outpatient Cardiac Rehabilitation is a great place to start. You can refer to the back of your Cardiac Rehabilitation Guidebook for an outpatient cardiac rehab program close to your home or here at MedStar Union Memorial Hospital. Open heart surgery is a major procedure that requires an extensive recovery. Remember to take it one day at a time and keep thinking positive thoughts. I wish you a speedy and healthy recovery at home.
Hi, my name is Robin and I'm a registered dietitian at MedStar Union Memorial Hospital. I'm speaking today about how diet is an important part of your recovery from open heart surgery. How you eat will help you recover in the speediest manner. After open heart surgery, many people have a poor appetite. They don't feel much like eating, and this is an important time for you to eat well. So take advantage of those times of the day when you have the best appetite and eat then. It may not be at supper time. By the end of the day, you may be actually too tired to eat. So if you want your largest meal in the morning, eat it then. The major restriction immediately after surgery is with sodium. Too much salt can cause your body to hold extra fluid and put more work on your heart. So try to restrict your intake of salty foods like cured and processed meats, olives, pickles, and other salty foods. If you find that you can't eat because the food doesn't have salt, then use some salt because it's important for you to eat, not to follow a rule. Don't take advantage of this, but be prudent in how you eat and the foods you choose. You're best with fresh, unprocessed foods. Protein is an important part of a healing diet. It helps with the recovery from the surgery and also with maintaining your muscle mass during this recovery period. Good sources of protein include lean meat, fish, poultry, and even shellfish. Often people are told not to eat shellfish because of the high cholesterol content, but in fact, only shrimp is really high in cholesterol. And you can even eat shrimp in small quantities like 2 to 3 ounces. Other shellfish like crab meat, mussels, clams, oysters, lobster are fine to eat, low in saturated fat and great sources of protein. Fruits and vegetables are also important as they're low in fat and have no sodium, so they can be eaten as much as you want. It also depends on how you cook them, of course. If you're going to add a lot of salt, maybe you need to change those food preparation habits for now. You may be taking a blood thinner after this surgery, in which case you should discuss any limitations in green leafy vegetables. If that's not the case, that you have to have these limited, eat lots of green leafy vegetables. They probably are the world's best heart-healthy foods. Whole grain foods have an important part to play in a healthy recovery diet. They aren't lower in calories or lower in carbohydrate, but the fiber and extra nutrients are important for your heart now and in the future. Sometimes people are told that with heart disease they should cut way back on their fat intake, and that's not true. But it is important that you find the healthy fats to fit in your diet. Fats from nuts and oils and fish fats. The fats that can be problematic for you are red meat fats, butter fat, and other hydrogenated fats that you find in bakery products, shortening, and butter and margarine. You can have little bits of this, but generally you want to limit your intake of those, what we call saturated fats. You may find that you have a loss of appetite after this surgery, and we encourage you to be patient as it may take a few weeks to a few months for your regular sense of taste to return. But be assured that you will be back to your normal taste in several months. In the meantime, you may find that certain tastes are sharp or meaningless to you, and just try other foods. Eating well after open heart surgery should not be a chore, but if your diet has been pretty rotten up until now, you may have to make major changes. If you've depended on fast foods, processed foods, frozen meals, and other shortcuts, you may find that these foods are too high in sodium and too high in what we call the bad fats, saturated fats, to be healthy for your recovery and your long-term prevention of further heart disease. You may need to learn some cooking skills. Be sure to ask your doctor, other nurses, or other health professionals for ideas for food preparation at home. If you live alone, you may want to ask for help from a neighbor, friend, or family member. The time and energy that it takes to prepare meals can be tiring and just really exhausting in the first few weeks after surgery. So seek some assistance for this. It's important to limit your caffeine intake after open heart surgery. Caffeine could increase your heart rate, increase your blood pressure, or otherwise cause some problems that could be mistaken for other heart issues. If you're a regular drinker of coffee or tea, try decaffeinated versions. If you drink cola beverages, you need the decaffeinated versions. You can probably eat a piece of chocolate a day and that caffeine won't be too much for you. Alcohol is another beverage of interest after surgery. You will probably need to restrict or avoid all alcohol for several weeks to make sure there's no interaction between alcohol and the medicines that you take. Beyond that, it's a discussion you need to have with your cardiologist of what level of alcohol you might be able to consume. If your appetite is poor and you realize you're not eating well, you may want to consider a meal replacement drink, such as Ensure, Boost, Carnation Instant Breakfast, or even Slim Fast. These provide necessary calories and protein for the healing process. Some people have problems with iron deficiency anemia after surgery due to some blood loss. If you're told that you have anemia, a low hematocrit or hemoglobin, you need extra iron in your diet. Good food sources of iron are meat, fish, poultry, and enriched grain products. You'll see the word enriched on foods like spaghetti and rice, where iron has been added back in after the milling process. The iron will help correct the anemia. If you have diabetes, it's very important to keep your blood sugar well controlled. High blood sugars will interfere with healing of your incision and the entire recovery process. You want to eat consistent carbohydrates, about the same amount at each meal, each day, and take your medicine the way you've been instructed. If you have excessively high blood sugars, call your primary care physician about adjusting medication. Normally, after a surgery, blood sugars run higher than the usual blood sugars, and you may see this and it's normal. If they don't come down in several days, be sure to call your physician. Your immediate concern is a healing diet that will help your body repair itself from the surgery. But your long-term goal is to prevent any further heart disease with great healthy eating of fruits, vegetables, lean meats, poultry, fish, and whole grains. Bon appetit!